Here's the expanded and detailed version of the content, adding explanations, context, and clinical significance. Gastrointestinal assessment. The gastrointestinal system of a newborn should be carefully evaluated to detect any abnormalities or complications that could affect digestion, excretion, or overall health. A. Monitor cord for meconium staining. Meconium-stained amniotic fluid can indicate fetal distress during labor, potentially due to hypoxia. Here's the expanded and detailed version of the content, adding explanations, context, and clinical significance. Chart 2. Gastrointestinal assessment. The gastrointestinal system of a newborn should be carefully evaluated to detect any abnormalities or complications that could affect digestion, excretion, or overall health. A. Monitor cord for meconium staining. Meconium-stained amniotic fluid can indicate fetal distress during labor, potentially due to hypoxia. The presence of meconium on the cord should prompt monitoring for aspiration, meconium aspiration syndrome. B. Assess for umbilical hernia. Umbilical hernias are caused by incomplete closure of the abdominal muscles. They are generally benign and often resolve by age 2 to 3, but larger hernias may require surgical intervention. C. Assess for abdominal depression associated with diaphragmatic hernia. A diaphragmatic hernia occurs when abdominal organs protrude into the chest cavity through a defect in the diaphragm. Symptoms may include respiratory distress, asymmetrical chest movements, and bowel sounds heard in the chest. D. Assess for abdominal distension associated with obstruction, mass, or sepsis. Abdominal distension can signal serious conditions such as intestinal obstruction, a mass, e.g., tumor or cyst, or neonatal sepsis. Immediate evaluation is critical, including imaging and blood work. E. Monitor bowel sounds. Normal bowel sounds should be present within the first hour of birth, indicating active peristalsis. Absent bowel sounds may suggest an obstruction, ill use, or another gastrointestinal anomaly. 3. Anus assessment. Proper evaluation of the newborn's anus is essential to ensure normal gastrointestinal function and excretion. A. Ensure that the anal opening is present. Imperforate anus, a congenital defect where the anal opening is absent, requires immediate medical intervention, usually surgical correction. B. Monitor for the passage of the first stool, meconium. Meconium, a thick, tarry stool, should pass within the first 24 hours of life. Delayed passage may indicate conditions like Hirschsprung disease, cystic fibrosis, or prematurity-related bowel immaturity. M. Genitals. The genital system of the newborn differs based on sex. Each should be examined for abnormalities or developmental irregularities. 1. Newborn with a vagina. A. Labia may be swollen, clitoris may be enlarged. These findings are normal and due to maternal hormone exposure during pregnancy. B. Smegma may be present, a thick, white mucus discharge found between the labia. It is harmless and resolves naturally. C. Pseudomenstruation. Blood-tinged mucus discharge may occur due to the withdrawal of maternal estrogen after birth. This is normal and temporary. D. Hymen tag may be visible, a benign finding requiring no intervention. E. First voiding should occur within 24 hours. Failure to urinate may suggest urinary tract abnormalities or dehydration, necessitating further investigation. 2. Newborn with a penis. A. Prepuce. Foreskin covers glans penis. Normal in newborns. Do not forcibly retract the foreskin as it can cause injury. B. Scrotum may be edematous, pendulous, and covered with rugae. Edema is often due to maternal hormones or the birthing process. It resolves spontaneously. C. Verify meatus at the tip of the penis. Ensure there is no hypospadias, meatus located on the underside of the penis, or epispadias, meatus located on the top. D. Testes are descended but may retract with cold. Retractile testes are normal due to the cremasteric reflex. Undescended testes, cryptorchidism, may require surgical correction. Assess for hernia or hydrocele. Hernias are more noticeable during crying and may need surgical repair. Hydrocele, a fluid-filled sac around the testes, usually resolves without intervention. First voiding should occur within 24 hours. Delayed urination may indicate urinary tract obstruction or kidney dysfunction. Spine assessment. The newborn's spine should be assessed for abnormalities that could indicate developmental issues. 1. Straight. A normal spine is straight without curvature or deformities. 2. Posture flexed. A flexed posture is typical for newborns and indicates intact muscle tone. 3. Supports head momentarily when prone. The newborn may momentarily lift the head, showcasing initial neck muscle strength. 4. Chin flexed on the upper chest. This posture is normal and reflects proper muscle tone. 5. Well-coordinated sporadic movements. Jerky but coordinated movements are expected as the newborn develops motor control. 6. Degree of hypotonicity or hypertonicity. Abnormal muscle tone may signal central nervous system damage or neuromuscular disorders. 7. Assess for hair tufts or dimples along the spinal column. Hair tufts or dimples could indicate spina bifida or other neural tube defects. Referral for imaging, e.g. ultrasound or MRI, is recommended. NASH-O extremities assessment. The extremities should be checked for structural abnormalities, fractures, and range of motion. 1. Flexed. Normal newborns maintain a flexed posture due to physiological tone. 2. Full range of motion. Symmetry in movements and muscle tone should be observed. Asymmetry may indicate neurological or musculoskeletal issues. 3. Fists clenched. Common in newborns, persistent tight clenching may suggest neurological concerns like cerebral palsy. 4. 10 fingers and toes all separate. Check for polydactyly, extra digits, syndactyly, fused digits, or missing digits. 5. Legs bowed. Bowed legs are normal due to intrauterine positioning and resolve with growth. 6. Major gluteal folds even. Uneven folds may indicate hip dysplasia. 7. Creases on soles of feet. Multiple creases are a sign of maturity, while smooth soles may indicate prematurity. 8. Assess for fractures or dislocations. Hip. Birth trauma may cause fractures, especially of the clavicle, which can be identified by crepitus or asymmetrical arm movements. 9. Developmental dysplasia of the hip. Use the Ortolani and Barlow tests to detect DDH. A click or clunk suggests dislocation or subluxation. 10. Pulses palpable. Radial, brachial, and femoral pulses should be strong and equal. Weak or absent pulses may indicate vascular abnormalities. Note on tremors. Slight tremors in newborns are common but should be monitored. Persistent or pronounced tremors may indicate hypoglycemia, hypocalcemia, or drug withdrawal. Blood tests can confirm these conditions.